If you love learning about health and wellness just like we do, go ahead and hit that like button and subscribe so you don't miss out on any of our future episodes. Today, we're going to be looking at Tadalafil. You might know it as Cialis. A lot of people think of it as, that little blue pill. But we're going to dig a little deeper than that today and uncover some pretty interesting facts. Like, did you know it can be taken in ways besides just a tablet? We'll get into that in a bit. And get this, some people are even using it in the gym.
Yeah, I've heard about that too. But let me just say right off the bat, I definitely don't recommend that.
Hold that thought. We'll come back to that. But first things first, let's start with the basics for anyone who might not be familiar. What exactly is Tadalafil?
So Tadalafil, like Viagra, is what we call a PDE5 inhibitor. Basically, it helps to increase blood flow to certain areas of the body.
Okay, so let's break that down a bit. What's actually happening in the body when someone takes Tadalafil?
Well, you see, to get an erection, you need a good balance of blood flow. Think of it like a garden hose. The wider the hose, the more water flows through, right?
Right.
Well, there's an enzyme in our bodies called PDE5, and it's kind of like a kink in that hose. It restricts blood flow. And
Tadalafil, it smooths out that kink.
So it's not like it's creating some sort of magical effect. It's more about, like, facilitating a natural process.
Exactly. You hit the nail on the head. Tadalafil isn't going to work all on its own. You still need sexual stimulation for it to actually, do its thing.
That makes sense. So we've talked about tablets, but I hear there are some other, shall we say, more interesting ways to take this medication. I'm talking pastilles, sprays, even implants.
You're not wrong. There really are a lot of different ways to administer Tadalafil. Tablets are definitely the most common, but there are also these things called sublingual pastilles, which dissolve under your tongue, thin strips that dissolve on your tongue, sprays, and even implants.
Implants.
Yeah.
You're going to have to tell me more about these implants. That's a new one for me. So basically, they're these really tiny pellets of Tadalafil that get inserted under the skin. A lot of times it's done with testosterone pellets, too. What this does is it releases a low dose of the medication continuously over time.
Wow, so it's like a constant supply instead of taking a pill every day.
Yeah. And, which way you choose to take Tadalafil really depends on your own needs and preferences. Also things like, how your body absorbs it, the dosage you need, and just what you're comfortable with.
Speaking of dosage, how much does someone usually take and how long does it last?
The standard doses for the tablets are usually 5 milligram or 20 milligrams, but again, it really depends on the person and what they're using it for. Now, how long it lasts, well, that's one of the reasons it's gotten so popular. It usually kicks in around 30 minutes after you take it, but the effects can last way longer than other PDE5 inhibitors, sometimes even up to 17 hours.
17 hours. Well, that's a long time. Planning ahead is definitely key here. Now, before we jump into all the more surprising ways Tadalafil can be used, I want to ask about something I'm sure a lot of listeners are wondering about: dosage.
Yeah.
How do you figure out the correct amount to take? Is there a magic number?
Well, I wish it were that simple, but unfortunately, there's no one-size-fits-all answer. The right dosage really depends on your medical history, what other medications you're on, how severe your condition is, and how your body reacts to Tadalafil. So it's really important to work with your doctor to figure out what dose is safe and effective for you.
So definitely not something to self-medicate with.
Exactly. Tadalafil is a prescription medication for a reason.
That makes sense. And I know we need to talk about side effects too.
Yeah, and just like with any medication, there can be some. The most common ones are headaches, stuffy nose, back pain, muscle aches, maybe some indigestion and flushing. But keep in mind, not everyone gets these side effects, and often they're pretty mild and go away on their own.
So it's all about weighing the benefits against the risks.
Exactly. And that's a conversation to have with your doctor. They can help you figure out if Tadalafil is right for you.
Now, earlier you mentioned that Tadalafil has some uses that go beyond just, erectile dysfunction. Can you tell us more about that?
Definitely. It's also prescribed for something called benign prostatic hyperplasia, or BPH.
BPH?
Yeah, BPH. It's basically when your prostate gland gets enlarged, and that can lead to some uncomfortable urinary problems like trouble starting or stopping urination, a weak stream, and having to go a lot at night.
So it's not just about, one aspect of men's health. It's addressing a wider range of issues.
Absolutely. It's about improving overall well-being. And, speaking of well-being, I know there's been a lot of talk about using Tadalafil in the gym, supposedly to enhance workouts.
Yeah, that's what I was hinting at earlier.
We'll definitely dive into that more in another episode. But for now, let me just say, I really don't recommend it.
Ooh, a cliffhanger. Okay, we'll have to come back to that. But for now, let's shift gears a bit and talk about some common concerns. One that comes to mind is dependency. Is Tadalafil addictive?
It's a good question, and the answer is Tadalafil isn't physically addictive, but it is possible to develop a psychological dependence on it, meaning someone might start to think they need it to function, even if their body doesn't physically require it.
So it's more of a mental thing than a physical one.
Exactly. And if you're having any concerns about dependence, definitely talk to your doctor. They can help you explore other options, like counseling or even using mechanical devices.
That makes sense. So it's all about finding the right solution for you. Now, let's address the elephant in the room. Does Tadalafil work for everyone?
That's a great call, and the honest answer is no, it doesn't. It works for a lot of people, but there are some for whom it just doesn't have the same effect.
I see. So who might not see the results they're hoping for?
Well, research has shown that about 35% of people don't respond to PDE5 inhibitors like Tadalafil, and that number can be even higher for those with conditions like diabetes.
Oh, wow. Why is that?
Well, with diabetes, you often see nerve damage and poor blood circulation. And unfortunately, those can impact how well Tadalafil works. And for people who've had prostate surgery, the percentage is even higher because sometimes the surgery can damage the nerves and blood vessels involved.
So even though it can be a huge help, it's not a guaranteed solution.
Exactly. And that's why it's important to have realistic expectations and work with your doctor to figure out the best treatment for you.
Well, this has been incredibly informative. We've learned so much about how Tadalafil works, the different ways to take it, and even some of the unexpected uses. It's fascinating that there's so much more to it than meets the eye.
I agree. And it just goes to show personalized medicine is really key. What works for one person might not work for another, and that's perfectly okay. It's all about finding what's best for you.
Absolutely, and that's why having open communication with your doctor is so important.
Couldn't agree more. And we're back. You know, before the break, we were talking about using Tadalafil in the gym.
Yeah, that really piqued my interest. Why do you think that's become such a popular idea?
Well, I think there's a misunderstanding of what Tadalafil does and what it can actually achieve. Some people think, since it increases blood flow, that'll translate into better pumps and endurance in their workouts.
So they're looking for that shortcut to bigger muscles, like those guys we see in the magazines.
Pretty much, yeah. They're hoping Tadalafil will give them that extra edge, amp up their workouts, and help them get those gains faster.
I get the appeal, but you said you don't recommend it. Why not?
There are a few reasons. The biggest one is that the evidence is super wint. Most of what you see online are just anecdotes, personal stories, not real scientific studies.
So more bro science than actual science, then.
Exactly. And even if there were some small benefit, the risks are just way too high. Remember, Tadalafil is meant to treat real medical conditions. Using it for something like enhancing your workout? Well, that's off-label use, and it can have unexpected consequences.
Like what kinds of consequences?
Oh, first off, you could have worse side effects. Remember those headaches, muscle aches, and flushing? Imagine those during a tough workout.
Ouch. Yeah, not exactly what you want in the middle of a set.
Right. And then there's the risk of priapism, which we talked about earlier. That's a prolonged erection, and it can happen no matter why you're taking Tadalafil.
Oh, man.
Yeah, it's a serious medical emergency and definitely not something you want to deal with in the gym. Then there's the potential for interactions with other substances, and that's a big deal for a lot of people who work out regularly.
Yeah, a lot of folks use supplements and things.
Exactly, and some of those supplements could react badly with Tadalafil. You could end up with a whole mix of chemicals in your body that you have no idea how they'll interact. It's risky.
Sounds like it. So you're saying there are better ways to improve workouts?
Absolutely. Focus on things like good nutrition, staying hydrated, getting enough sleep, and having a solid workout plan. Those are the foundations.
So a holistic approach, not a quick fix.
You got it. Building a healthy body takes time and effort, and there's no real shortcut to that.
Good advice. We've talked about the downsides, but what about effectiveness? Can Tadalafil become less effective over time?
That's a smart question, and the answer is yes, it can happen. There are a few reasons for that.
Interesting. Like what?
One is that your body can actually build up a tolerance to the medication. It's kind of like what happens with caffeine. Drink coffee every day, and you might need more to feel the same buzz.
So the body gets used to it.
Exactly. Your doctor might suggest adjusting the dosage, but it's important to rule out any other medical issues that could be at play.
So it might not be as simple as just upping the dosage.
Right. It's got to be about treating the whole person, not just the symptoms.
That makes a lot of sense.
Yeah, and that's why being open with your doctor is so important. Tell them about any changes or concerns you're having, and they can help you figure it out.
It's all about that communication.
Definitely. Now, I want to address a common myth about tadalafil, that it's an aphrodisiac.
You mean that it boosts libido or sexual desire?
Yep, but that's just not true. Tadalafil doesn't magically make you want to have sex. It simply helps you physically respond when you're already aroused. Remember, you still need that stimulation for it to work.
So it's about addressing a physical issue, not a mental one.
Right on. It's not a love potion, just a medication.
Good to know. Another myth I've heard is that Tadalafil is only for older men.
I hear that one a lot, and I get why people think that. It's often associated with age-related stuff.
Makes sense.
But the truth is that erectile dysfunction can affect guys of any age. It's not just an old man's problem. Stress, anxiety, your lifestyle, even some medical conditions, they can all contribute to ED.
So it's more complex than just getting older.
Way more complex, and it's something men should feel comfortable discussing with their doctor, no matter how old they are.
Absolutely. No shame in taking care of your health.
Exactly. Now, let's move on to debunking another myth I often hear. People sometimes think that if you take tadalafil regularly, it means your ED is getting worse.
Oh, interesting. I can see how that assumption might come up.
Yeah, but it's not necessarily true. Remember, we talked about how the body can build up a tolerance to medication over time. Well, that means you might need a higher dose, or more frequent doses, to get the same effects as you did when you first started taking it. It's not because your condition is worsening, it's just how your body adapts.
So it's not a sign that things are going downhill.
Nope, not at all. It's just part of the process for some people.
That's reassuring. Now, I want to touch on a concern that I've heard from some listeners. They're worried about potential long-term effects of taking Tadalafil. Any insights on that?
Sure. So when it comes to long-term effects, the research is still ongoing. But the good news is that for most men, tadalafil is considered safe for long-term use as long as it's prescribed and monitored by a doctor. Of course, like with any medication, there are potential risks. And those risks can vary depending on your individual health history and other factors.
So it's a personalized thing.
Exactly. That's why that conversation with your doctor is so important. They can assess your individual risk factors and make sure you're using tadalafil safely. Now, I know there are a lot of questions about the impact of tadalafil on fertility, and rightfully so.
It's a natural concern for couples who are trying to conceive.
Absolutely. Now, here's what we know so far. Studies have shown that tadalafil does not directly impact sperm count or motility.
So it doesn't make a man less fertile.
Correct. However, there is some evidence that suggests tadalafil might affect the shape of sperm. But more research is definitely needed in this area. If you're concerned about fertility, it's always best to talk to a fertility specialist. They can provide personalized advice and guidance.
This has been so insightful. One thing that's become clear throughout this deep dive is that Tadalafil is a complex medication with a lot of nuances. It's not as simple as many people think.
Absolutely. And that's why it's so important to approach it with a balanced perspective, understanding both its potential benefits and risks, and always, always consult with a healthcare professional to make informed decisions about your health.
Couldn't agree more. We're going to take a quick break, but when we come back, we'll wrap up our deep dive on Tadalafil with some final thoughts and takeaways. And we're back for our final thoughts on Tadalafil.
It's been a really interesting journey.
Definitely. I feel like we've gone beyond the surface and gotten a much deeper understanding.
Yeah, we've talked about how it works, all the different forms it comes in, the pros, the cons, busted some myths.
Absolutely. And I think a key takeaway for our listeners is that Tadalafil isn't a one-size-fits-all kind of thing.
You're so right. What works for one person may not for another. And that's totally normal. Our bodies are different, and we react to meds in our own ways.
Exactly. So it's about finding the right approach for your own needs, working with your doctor.
Couldn't have said it better myself. And that's where having those open conversations with your healthcare provider comes in. They can figure out if tadalafil is right for you, check your overall health, and make sure there aren't any issues with other meds you might be taking.
Speaking of individual needs, we talked about Tadalafil being used for both ED and BPH. Can you remind us how it works in each case?
Sure. So for erectile dysfunction, tadalafil helps relax the muscles in the blood vessels of the penis. That allows more blood to flow in, making it easier to, well, achieve and keep an erection.
And what about BPH? How does it help with urinary symptoms?
It works similarly. It relaxes those muscles in the prostate and bladder, helping urine flow better and reducing symptoms like having to go frequently or struggling to start or stop the flow.
So it's targeting those smooth muscles just in different areas depending on what you're treating.
Yeah, that's a good way to put it.
Mm.
Shows how versatile this medication can be.
Now, we've mentioned responsible use throughout our deep dive. What exactly does that mean for someone thinking about taking Tadalafil, or maybe already on it?
Responsible use means a few things. The most important, talking to your doctor. They'll help you decide if Tadalafil's right for you, find the right dose, and set up the best plan.
So no self-medicating or just taking advice from a buddy or like something you read online?
Definitely not. It's got to be between you and your doctor. They know your health history, can spot any potential risks, and make sure you're taking it safely and that it's working for you.
And I'm guessing it also means knowing the side effects and getting medical help if anything feels off or unusual.
Absolutely. Even though Tadalafil is generally safe and people tolerate it well, there can be side effects. So if you notice something strange, don't wait. Call your doc.
Better to be safe than sorry. Yeah.
Exactly. Now, are there any folks who should avoid taking Tadalafil?
Good question.
Yeah, there are a few groups where it might not be a good fit or they should be super careful, like people with serious heart problems, uncontrolled high blood pressure, or a history of stroke.
So anyone with existing heart issues should be extra cautious.
Absolutely. Also, you shouldn't take Tadalafil if you're on certain meds, like nitrates, which are often prescribed for chest pain.
That's because of a potential interaction, right?
Right. Mixing nitrates and Tadalafil can cause a sudden drop in blood pressure that can be super dangerous, even life-threatening.
So important to tell your doctor everything you're taking, all meds, even supplements, to avoid any bad reactions.
You got it. And it's worth noting that Tadalafil isn't recommended for women or kids.
So it's specifically for adult men who've gotten the okay from their doctor.
Exactly. Okay, before we wrap up this deep dive, I want to leave everyone with one last thought.
I'm listening.
When it comes to our health, there's no quick fix, no magic pill. It's about the big picture, making healthy choices, talking honestly with our doctors, and really being proactive about our well-being.
Yeah.
That's what matters.
That's a great way to put it. And I think it wraps up our Tadalafil discussion perfectly. We've learned a lot about how it works, what it's used for, the good, the bad, the myths, everything.
It's been a pleasure sharing this with you and our listeners.
It's a huge thank you to our expert for guiding us through all this. Be sure to subscribe to HealthyCast for more deep dives into health and wellness. Until next time, stay curious, stay informed, and stay healthy.